Noella. I saw a video of an amazingly talented young Canadian woman in the middle of having an asthma attack. She was exploring the use of relaxation techniques instead of drugs to treat her asthma. Now, when you have asthma, you're typically prescribed some kind of steroid taken daily to reduce inflammation in your lungs, and you're also given a rescue inhaler. I'm pretty good about taking my own meds. I use an Advair Discus and have a rescue inhaler for emergencies. Watching this young sister wheeze set off alarm bells for me, and I guess the mama bear came out as I went ballistic about her not taking her medicine. Chronic illnesses can be deceptive in that we sometimes don't take them seriously enough. They don't seem able to cause death. When I was young, a family friend stayed with our family after her daughter married and emigrated to the States. Her name was Noella, and she had severe asthma. I awoke one night to voices and all the lights on in the house, and was told that she had died. She was already deep in an attack when the ambulance arrived, but it was too late. What had been her bedroom became my bedroom, and I slept there for years and often thought of her. She had been a really sweet lady. I often thought of the fact that something so simple could kill. Noella had what I would call an effective cure. Effective cure means you have virtually no symptoms and can function normally. They can make disease seem simple. But effective cures are deceptive when they cause you to stop taking your meds and you forget that the meds are what furnished the effective cure in the first place. Control versus rescue. A chronic illness like asthma, for example, is kept under control by using steroids, avoiding irritants and allergens, tending to your overall fitness and nutrition, and utilizing other things like meditation, calming techniques, herbal medicines, etc. I would call all the above meds in that you use them daily. A rescue inhaler is special though. It is a rescue or emergency technique. Rescue inhalers are not intended to be taken daily to control asthma, and therefore don't fall into the category of a med as I've defined it. I guess they could be called controllers or preventers. If you use your rescue inhaler several times per week, your asthma is not controlled. Put down the damn salad, you're having a heart attack. An attack is an emergency situation and needs to be responded to with speed and urgency. If you have heart disease, for example, and you begin to have a heart attack, that would not be the appropriate time to think of eating a low-fat meal. Even though the low-fat meal is an appropriate preventer or med when you are not having an attack. A low-fat meal at that time would not mitigate your heart attack. An attack is a point of crisis, and at the point of crisis, you need crisis-type intervention. In asthma, that would be a rescue inhaler or Ventolin. In a heart attack, that might be a vasodilator. The race. You are in a race against your disease. Drugs and adjustments to your lifestyle put distance between yourself and the disease, and frankly, death. The question is, just how much distance do you want between you and death? I'm thinking a whole damn lot. The more diligent you are in treatment, the more room you have, the more cushion you give yourself. If you're having an asthma attack, it's not the best time to use relaxation techniques alone. You need to use your rescue inhaler. And if that doesn't work, you need to get to the emergency department of your local hospital. If you're having a heart attack, let the salad wait till after you get out of hospital. Thanks for listening.